Hi, my name is Jana Caceres. I'm going to do my head to toe assessment. So I'm going to walk into the patient's room and I'm going to do hand hygiene, wash my hands, dry them, and I'm going to go over to the patient and introduce myself. My name is Jana Caceres. I'm going to be your nurse, and look at their armband. And do you know your name?
Christina Cardinale,
And what's your date of birth?
8/28/77.
Okay, do you know where you're at?
The hospital.
And do you have any allergies?
Iodine.
Iodine. Okay, so I'm going to make sure that I get an allergy band and I'm going to put it on the patient, and then we're going to start our assessments. So I am going to explain that I'm going to do head to toe, and then I'm going to have the patient stand up, and this way I can check her musculoskeletal system. I'm going to have her walk on her tippy toes that way, please. Okay, stop, and can you come back on your heels? Okay, I'm gonna also have her bend down. I'm gonna check the skin, and I'm gonna check for lordosis, kyphosis, or scoliosis, and she is able to. I'm gonna check the hips. All right, you can stand back up. Everything looks fine. I'm also, while she's standing, I'm gonna get a height and weight. So we do the height and weight, and then I'm gonna have her come back and sit down. I'm gonna don gloves. Okay, and I'm gonna check for her scalp. Check her scalp and her head. Make sure everything's symmetrical. Her ears, her nose, her eyes. Checking for any infestation, and she is negative. Then I'm going to look at her eyes. I'm going to look at her conjunctiva. It's pink, and her sclera is white. I'm gonna check her eyes, the pupils. Check the pupils. Everything is intact. And then I'm going to do the cardinal signs. So I'm going to have her follow my finger. Okay, cardinal signs are good. Then I'm going to check the nose. It's midline. And then I'm going to check inside. No drainage. No cuts or sores. And then I'm going to press and see if her nostrils are patent. Please blow out. Okay, good. All right, now I'm going to check the mouth. So mouth, you can stick out your tongue, move it side to side. Okay, good. I'm going to inspect, see if there's any cuts or bleeding or anything going on in the mouth. Say ah.
Ah.
Uvula is midline. Teeth are intact, and it's pink and moist. Then I'm going to look at the shoulders. Oh no, not the shoulders, I'm sorry. The ears. I'm gonna look for any kind of drainage. I'm gonna pull the pinna from back, look inside, and it's gray. No drainage. Can you hear me? I whispered. I'm gonna check the other ear. Pull the pinna back and up, and I'm gonna check for drainage. No drainage, and it's gray. And yes, she can hear in both ears. Okay. And then I'm also gonna have her shrug her shoulders. That's also gonna go with the cranial nerves. And I'm gonna inspect the trachea is midline. I'm gonna check the thyroid as well, and I'm gonna check the lymph nodes, submandibular. Okay. Lymph nodes, everything is intact and good, no swelling. Okay. Now I'm going to have you come to the bed. And take off my gloves. now I'm going to come over and I'm going to palpate the chest and percuss. Okay. And then I'm going to inspect. No sores, no lesions. And I'm going to listen. Deep breath in and out. Okay. Again. 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 Okay, and that's where I listened to the apical pulse. It was mid-clavicular, 5th intercostal space. Okay, I'm going to have her turn to the back. And I'm also going to inspect the back here. And then I'm going to palpate. I'm also going to percuss. Okay. And then I'm going to listen. Deep breath in and out. Again. Okay. Again. Okay. Again. And one more time. Okay. I'm going to have the patient lay back in a 45-degree angle in the bed. I'm going to check. I'm going to have her turn her neck and check for jugular distension. That is negative. Check the other side. Negative. Okay. And now I am going to listen to heart sounds. Okay, everything sounds fine. I'm also going to check for pulses. So I'm going to check the temporal pulse. Good. And check the carotid. I'm going to check the radial bilaterally. And I'm also going to check the brachial bilaterally. Okay, I'm also going to check for cap refill. Okay. Check the skin for tenting. Okay, everything looks good. And then I'm gonna check pedal pulses as well. Okay, everything looks good. Sorry, I need to move it over a little bit. Okay. All right. So I'm also gonna have the patient push her. Can you push against my hands? Up. Good. And push back against my hands. All right, good. And then I'm gonna have you lift up your leg. Good. I'm gonna have you lift up your other leg. Good. Okay. Now I'm gonna go to the abdomen. So first in the abdomen, we're gonna listen. We're gonna look at it and it's flat. And then we're gonna listen. And then we're gonna percuss and palpate because we don't wanna move stuff around. So we wanna listen first in all 4 quadrants. We're gonna start in the right lower. Okay, and she's hyperactive. My patient's hungry. Now I'm going to percuss. I'm listening for any dull sounds. That's good. And now I'm going to palpate. Any pain?
No.
Okay. All right. And then I'm also, while I'm here, I'm going to have her squeeze my hands. All right, good. And then can you push up on my hands? Okay, and then can you push down? All right. And her musculoskeletal is intact. And that will conclude my head to toe assessment.